My wife and I are blessed. We have 7 children. And we love them all. They're all our favorites. Each child we have is our favorites. And Beth was extremely special.
She was kind, generous.
She had like a really sweet and caring personality.
She had this beautiful smile, like an inviting.
She could make friends with basically any stranger on the street and get a smile or a laugh out of them.
Beth was having a hard time sleeping for maybe 4, 5, or 6 weeks. And so we said, Beth, you should go to the doctor and get something to help you sleep.
He said, okay, well, I'll try to give you something to lessen your anxiety, and it should help you sleep.
Within 5 minutes, a 5-minute visit, he prescribed her Paxil.
When I first saw Beth right after she went on the Paxil, she was different. Like, I felt like she was drugged.
And by the second or third day, she's like, I don't know, I just don't feel right. You know, I feel strange in my skin.
But after about 3 or 4 days, I remember that Beth was, at times, very different, like sullen, keeping to herself.
My mom and her were having dinner, and she said she didn't have any real emotion. Like, she kind of felt emotionally numb.
She was like a different person. Like, she just seemed like she was under the influence of something. She didn't seem like herself. She seemed like she was tripping out.
I talked to her on the phone, and she told me she didn't want to be there. And I was like, why don't you want to be there? She's like, I just don't feel like myself. I just feel like crazy. I just don't feel right.
I truly believe that she was hallucinating maybe and going in and out of this psychotic state at this point.
It seemed like she was melting down, like emotionally. She was becoming worse every day.
I said, are you suicidal? I actually asked her. And she laughed at me. And she said, no, I would never do that.
I'm thinking in my mind, I'm just going to lay down next to her and I'll rub her head and I'll talk to her and we'll try to figure out what we're going to do because something's not right here. And my son Matthew was right behind me going upstairs. And when I got to the top of the stairs, I saw her hanging in the hallway.
Then the police were all over the place and people were coming and going. And about 3 hours, 4 hours after my daughter died, one of my friends came over and said, you know, I was speaking to so-and-so, one of our other friends, and she said, oh, Beth must have been on Paxil. That's the only way she would kill herself.
It just wasn't her. Like, there was nothing in her that would have done that. She was the most non-violent, like gentle. It's a violent way to die.
It had to be the drug. There was no other answer.
If we knew what we knew now, Beth would be here with us today. I know that for a fact.
Η τραγική ιστορία της Beth Winter είναι μια από τις πολλές. Μια ιστορία που επαναλαμβάνεται όποτε χορηγούνται ψυχοτρόπα φάρμακα. Οι ψυχίατροι επιμένουν να πιστέψετε ότι τα φάρμακά τους είναι ασφαλή και αποτελεσματικά επειδή αυτοί είναι οι ειδικοί στην πνευματική υγεία και όχι εσείς. Αλλά η μία περίπτωση μετά την άλλη αποδεικνύει ότι το να τους εμπιστευτεί κανείς μπορεί να έχει καταστροφικές συνέπειες.
Psychiatry is pseudoscience. It's false science. It cannot withstand rigorous review if people would just look at the evidence.
If they help anyone, it's not worth the risk to the people that are harmed by them.
They are betraying every customer they have.
They don't know what they're doing, and we need to educate the public to use their feet and walk away.
Και πώς μπορεί να εκπαιδευτεί περισσότερο το κοινό? Ασκώντας ένα κύριο ιατρικό δικαίωμα που δεν είναι πολύ γνωστό στους ασθενείς, αλλά οι ψυχίατροι το ξέρουν καλά.
We want to be able to present the patient with alternatives. And one of the central ideas in ethics is informed consent.
The components of informed consent are letting the person know, first of all, what the diagnosis is and what it's based on so that they can say, this is why we need to treat you. And secondly, what the treatment is.
Every patient in the healthcare system has a right to informed consent. That is, they have a right to be told the risks and benefits of the treatment, the risks and benefits of alternative treatments, and the risks and benefits of no treatment at all.
Patients should be totally informed, fully informed about every medication that the psychiatrist offers to them to take or says they should take.
Και οι μελέτες επιβεβαιώνουν ότι πολύ λίγη πλήρης και ακριβής πληροφόρηση φτάνει στο κοινό για τα ψυχιατρικά φάρμακα. Οπότε, από τι συνίσταται η πλήρης και ακριβής πληροφορημένη συνένεση για τα ψυχιατρικά φάρμακα? Αυτοί οι γιατροί και εμπειρογνώμονες έχουν εκτεταμένη εμπειρία στο θέμα. Το πρώτο τους επιχείρημα: οι ψυχιατρικές διαταραχές δεν είναι πραγματικές ασθένειες που απαιτούν ιατρική θεραπεία.
It's true that there's no biological findings that really support any of these psychiatric diagnoses being medical illnesses. And the burden of proof really is the other way around. It's not that you have to prove that there is no biological science. The burden is on psychiatry to prove that there is.
There's no blood test. There's no lab test. There's no x-ray. These are just clusters of behavior that a group of psychiatrists have voted that it's a disease.
Can you imagine doctors having to have powwows to decide if a heart attack is a real disease or not? No, they don't have to decide that. They don't have to have a vote on that.
They should be asking the doc, geez, doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told, we don't have a chemical test for that.
There is no such thing as a chemical imbalance. And any psychiatrist that you talk to, if you ask him this question, they'll all admit it in private, but they won't admit it in public. It's a scandal.
So this is all subjective. Nothing objective about psychiatry.
Δεύτερο, δεν υπάρχει επιστημονική απόδειξη ότι τα ψυχοτρόπα φάρμακα επιλύουν διανοητικά προβλήματα.
Since there is no measurement for these psychiatric diagnoses, because they're really just subjective, for the same reason there really can't be a measurement for the effects of the drug.
In terms of medication, the evidence that's claimed is the medications are highly effective and not very toxic. But actually, in fact, the data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
Τρίτο, τα ψυχοτρόπα αποκρύπτουν συμπτώματα και δημιουργούν σοβαρές βραχυπρόθεσμες και μακροπρόθεσμες παρενέργειες.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease, medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of death from psychiatric drugs? Absolutely yes.
Τέταρτο, τα ψυχοτρόπα φάρμακα μπορούν να προκαλέσουν εξάρτηση και εθισμό.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
Πέμπτο, τα περισσότερα διανοητικά προβλήματα προκαλούνται από μια φυσική αρρώστια.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient.
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
Έκτο, όσο σοβαρή κι αν είναι η συναισθηματική ή η ψυχολογική κατάσταση, υπάρχουν πολλές αποτελεσματικές επιλογές που δεν προϋποθέτουν ψυχοτρόπα φάρμακα.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
Και επειδή οι περισσότερες επιλογές χωρίς φάρμακα σπάνια αναφέρονται στους ασθενείς, δεν δίνεται σχεδόν ποτέ πραγματικά πληροφορημένη συνένεση.
When you get into informed consent, it's almost a responsibility of the patient to make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor, but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
Και καθώς η μοντέρνα ψυχιατρική έχει εισχωρήσει στον κόσμο μας τα τελευταία 50 χρόνια, έτσι έχουν και τα ψυχοτρόπα φάρμακα. Αλλά υπάρχει ένας τρόπος για να ξεσκεπαστεί αυτή η ιατρική κατάχρηση, αναφέροντας όλα τα παράπονα και δυσμενείς αντιδράσεις των ψυχοφαρμάκων στην Εθνική σας Υπηρεσία Ελέγχου των Φαρμάκων. Το MedWatch είναι το ομοσπονδιακό πρόγραμμα λήψης αναφορών στη ΣΥΠΑ.
MedWatch is a voluntary reporting system, a passive reporting system where doctors, patients, healthcare providers, pharmacists, anybody really can make a report saying that they think that what they experienced or what their patient experienced was an adverse drug effect.
And this is what we call post-marketing surveillance. And this begins to get a look at what the side effects of long-term or chronic use of these drugs really is.
The FDA admits that probably only 1% of all the adverse drug effects are actually reported by patients or physicians.
Μόνο μέσω της αναφοράς όλων των δυσμενών αντιδράσεων των φαρμάκων θα έρθει στο φως το πραγματικό μέγεθος του τρόμου των ψυχοτρόπων φαρμάκων. Έχετε τα γεγονότα. Δείξτε αυτό το βίντεο στο γιατρό σας και μην επιτρέψετε στον εαυτό σας, στους φίλους σας και στα αγαπημένα σας πρόσωπα να γίνετε η επόμενη στατιστική της μεγάλης επιχείρησης χορήγησης ψυχοτρόπων. Για να μάθετε περισσότερα για την ψυχιατρική και τη χορήγηση ψυχοτρόπων φαρμάκων ή για να αναφέρετε μια περίπτωση ψυχιατρικής κακοποίησης, ελάτε σε επαφή με την Επιτροπή Πολιτών για τα Ανθρώπινα Δικαιώματα.